So BodyTite is a radiofrequency-based device, so it's an energy-based device that we typically do with liposuction. And so the traditional liposuction procedure, you're just removing the fat, but what it doesn't really do is cause the soft tissue to contract down. And so when we add in BodyTite with liposuction, the radiofrequency energy heats the deep tissue up in the fat, and it causes the skin and that whole layer to contract down by about 30 to 35%. So in a lot of patients, they're going to see a lot more contraction and tightening of that skin as opposed to just traditional liposuction where you're removing the fat. So in general, the overall result tends to be better. So there are a lot of patients who are on GLPs and have lost a lot of weight. Those patients will have a lot of excess skin. They're not good candidates for BodyTite. So it tends to be more of a fit group of patients that have had, a couple kids and have those areas that have some laxity that is bothersome. Patients that tend to be 10 or 15 pounds overweight and have stubborn areas of fat, they're good candidates for BodyTite, and they'll get that additional tightening with BodyTite compared to liposuction alone. Patients that have lost a ton of weight, which is very common now with GLPs, they don't tend to be as good of candidates for this, and you tend to have to do more of an excisional procedure with that, like a tummy tuck or an arm lift or a thigh lift. BodyTite is different than cool sculpting. So cool sculpting is more of a non-invasive treatment that you can do in the office. It's really non-surgical. You place a paddle and it cools the fat cell down and it causes cryolipolysis. With BodyTite, you're heating the tissue, so it's sort of the opposite of that. It breaks the fat cell up, it liquefies the fat, but the energy also causes the tissue to contract down by about 30 to 35%. So in general, you're going to see more of a result with BodyTite than you would with cool sculpting. So this is the BodyTite handpiece, and the way that this works is after the patient is anesthetized, you put this piece underneath the skin, and this stays on top of the skin, and it heats that tissue up in between, and it liquefies the fat, and it causes the skin and the vertical bands to contract down by about 30 to 35%. I would say 75% of the BodyTite cases I typically do in the operating room, and it really depends on how many areas you're treating. So if you're treating a lot of areas, we'll typically do it with an anesthetic in the operating room. If we're doing a very focal area, then that's something that we can do in the office with what's called tumescence, which is the solution we use to numb up the area we're treating.